Hi, it's Dr. Noel Williams, Oklahoma City, Oklahoma Optimal Health Associates COVID update. So let's talk about statistics. They're rather mediocre. 49,000 new cases, another 785 deaths in the country. Oklahoma a little better, about 750 new cases, about 6 or 8 new deaths. But we're unfortunately at 1,119 deaths in Oklahoma and over 100,000 cases now. In the United States, I can't even keep track of the number of cases. There's so many. The total, about 220,000 deaths. So COVID's really booming. The second wave's here. It's going to escalate. The CDC or NIH or somebody or other predicted 20,000 deaths between now and the end of the month, which is really sad. But what would we expect when we've had no plan for outpatient therapy? There's none still. It's up to people like me to read the literature and come up with a plan. And we're doing our part, and I've done my part on my 70 to 80 COVID patients I've treated. And a few of the other doctors I know and the primary care ones who have actually treated, which are like hen's teeth. There's not that many of them in Oklahoma who do treat people. They've treated their 100, 200 patients. But the vast majority of people don't get any outpatient care. And so then it's the whimsy of the virus then if they're gonna make it or not by the time they get to the hospital. Again, the NIH, CDC, complete and total failure. Fauci said forever there was no nutritional supplementation that mattered for immune function, which is just horse, you know what. But he finally admitted vitamin D mattered. I was like, oh my God, finally, he's only let 200,000 people die. But, but he's about the vaccine, and that's life, and that's what we can do. So I just think everyone needs to remember that the medical leadership in this country and then the academic medical leadership in most of the country failed us, and it's tragic. And so that's what we need to focus on. And when we go back through this over time, that's what we need to focus on. And the actual administrative failures of the Trump group, while they will also be very notable, and I think they've already been criticized very much, which is very deserved, I also think that the reality is those pale in comparison to the medical industrial establishment only caring about big pharma and vaccines and not doing anything to educate the public on nutrition, which would have been way more effective than masks, and then outpatient therapy. And it's an epic error that one day will become clear. But the problem is it's not going to change, and that's what I need everyone to understand. Whether Trump wins or loses, nothing's going to change, because as a wonderful counselor in our office once said, not my monkeys, not my circus. Well, in this case, these monkeys are our leadership team in the health agencies. So even if Biden comes in and there's not a global change with those people and people who really want to help us, nothing is going to alter. And it's a failed strategy to do more lockdowns and more masks and more of that. Now, I still am a big believer in social distancing and doing masks, but it's always combined with nutrition and appropriate targeted suggestions or recommendations on at-risk populations, so older people or people with chronic severe illness. And that's where we need to focus. But again, we can't get any leadership from our health team. So that's life. So again, nutrition. That's what you need to do. You need to find someone who'll give you early interventions if you get sick. Remember the Zinc pulse, always helpful. I've gone over it 1,000,000 times. It's on the website. Then you want to be on your vitamin D, your multivitamin. You want to be on your omega-3, especially if you're getting anywhere over 40. There's tons and tons of post-COVID issues from thromboembolic events. So even if you survive, you can still have about a 50% chance of having some long-term stuff. And that's what we're seeing in people. Thankfully, we've had more mild issues that we're just still dealing with. But again, they're issues. And so that's what we want to think about. So Kim, was there anything else? Any questions tonight?
Yeah, you did have some questions, and you brought up Zinc pulse. Let me go back to this. one person just commented, how often are you recommending the pulse of 20 milligrams? She was diagnosed, and then her doctor said to do 200 milligrams daily. She did it for 3 days and feels terrible from the zinc. Doesn't feel so
That's
bad from
not,
the COVID.
so that's the wrong way to do zinc. So that's how you get a toxicity. So you do a pulse of 150 to 200. So basically, if you're 150 pounds or less, you do 150. If you're 150 pounds or more, you can do 200. You do it that day. Then, and you break it up into increments 30 to 50 milligrams to hit the number with food, and you spread it out over an hour or two every dose. You then do not do any zinc the next 2 days. None. So if you do it on Monday, the zinc pulse, Tuesday, Wednesday off, and then you do it Thursday again. So the third day you do it again, and then you're done with the zinc. You're not doing any more zinc for a while because you've done what you can to hurt the virus with the zinc. We're not going to get much more out of that intervention. But if you keep on doing high amounts of zinc, you're going to get sick because it's too much zinc. So you feel like dog do and your stomach's going to be a wreck. So that is not how, we do not do 200 milligrams every day or 150 milligrams every day. So no, you do a point A, and then 3 days later, point B, and you're done.
Okay.
For at least a week or two, and then we'll figure it out from there.
Okay. So then just some other questions. Can herd immunity be reached without a vaccine?
Herd immunity can be reached without a vaccine. Let's talk about immunity for a minute, and just immunity with people. So there's a case in Nevada where someone may have gotten a second infection. There's a case in Hong Kong. And so there may be some isolated second infections. Again, the vast trend of these cases, 95% have turned out not to be. It's hard to know if they truly are or aren't, but this is the bottom line. There is a level of immunity already in the population that's been clearly established by multiple trials, even the summary trial in the journal Science that Fauci mentioned. And since some people really, again, hate Trump, and since the journal Science actually had an editorial against him, they should like that journal because they came out against Trump, but they also came out against Fauci and said there was potential immunity or cross immunity from corona, even though Fauci keeps on trying to act like there isn't. So it's a baseline 30%. So the first thing, about 30% of us probably have some level of immunity already. If you get COVID, the vast majority of people are going to have some level of resistance to it for at least the first 3 months after the infection, and perhaps for 6, 12, or 18 months until there's more major mutations. Now, that could change based on mutational stuff. If the virus has a major mutation at the tip of the spike protein or at the HIV section of the spike protein, then that may change things, but we'll know that relatively quickly as case numbers alter and they look at the genetics, which they do fairly frequently. So again, there's going to be some level of immunity. The question is, how many people have to get infected before there's herd immunity? It's 70% of the population. So the World Health Organization came out this week and said it would be a vast moral failure. Like they have any leg to stand on as one for hiding the virus and catering to the Chinese government, which if any of you don't believe that, turn me off right now because your head's in the sand. You haven't looked at any of the data of what's happened. And that's why, this week the WHO came out and said, we really need to open up the global economy because the Chinese government told them, hey, we really need to open up the global economy because the Chinese economy is in the tank. And so they're starting to feel a little bit concerned. So the World Health Organization has said, we can't do herd immunity. Every one of you little people, because you're all little drones with no brains, have to take the vaccine. Well, if you're a drone, you take the vaccine, or if you're a super high risk person, you may want to consider taking the vaccine. But if you're a healthy person, think about it. Make a decision. You're an American. Remember, we're Americans. Americans are allowed to make decisions. It's not a dictatorship yet. So, we can make decisions. I don't know if that answered that, but so herd immunity can occur. Herd immunity has always occurred eventually with infections.
Okay. If you have tested positive for the antibodies and you're exposed to someone with COVID, can you be contagious to other people?
Well, that's an excellent question. I think it's really, really hard for you to get reinfected in the first 3 months. I think there's fairly universal agreement on that. Beyond the first 3 months, it would be a theoretical concern of getting infected. So since there's now, I think, a global of 4 cases of reinfection potentially that are still under study out of 32 million people who've been infected. So there may be a few more of them. There may be, who knows. But the chance ultimately of being infectious again is probably in the range of, 1 in a million, maybe 1 in 500,000. It's some teeny tiny number. So I don't know if I can answer that directly. Do you think, call your doctor and help them to put the pressure on them. I don't think you have much risk of infecting anyone. You got to monitor for symptoms like anyone who gets exposed, but I think it's extremely unlikely you would get reinfected if you have positive neutralizing antibodies or you're.
So I'm going to ask it in a different way. So as a non-clinical at all, so if you have the antibodies and you're exposed, I'm going to say I'm not infected at all. I didn't get sick. I'm not getting tested. Whatever. Is there any chance that I could pass it on to somebody else without me getting? I'm going to use the word infected again.
You can't. If you're not infected, you're not spreading it.
So I can't have it on my hands or something.
Well, yeah. You could always have it on your hands, but if you wash your hands, it's gone.
Okay.
But you could get that from going to a store. So the whole thing is, if you get re-exposed, if you've already had the infection and you have antibodies, you have to self-monitor. You need to wash your hands, you wear your mask, and you watch for symptoms. And if you start getting symptoms, you're going to need to get tested again. The problem is, though, if you're within the first 3 months, your test may be positive anyway, and you could have something totally different. So again, it gets a little bit rigmarole-ish.
Somebody asked if there is an intestinal component to COVID.
Yes, there's absolutely. Intestinal symptoms are in the top 5. There's one of my patients, her only symptom was nausea, anorexia, and diarrhea for a week. So that is there are often a mix of symptoms, but some people only get the GI symptoms. And interestingly enough, if you're culturing stool, if you're a scientist, the stool cultures will stay positive well past 3 months in some patients, even though they're not infectious, because there's so much viral particles in the GI tract.
Is there anything connection or anything different for people that have the MTHFR? Which a lot of people won't know what that is, but...
So MTHFR is one of my favorite things to talk about in clinic, but it's especially fun to say what MTHFR stands for. Methylene tetrahydrofolate reductase. Let's see how many of you could say that. It took me 10 years, so don't worry. So for this particular issue, I have not seen anything suggesting it. I'll do a literature search. MTHFR has a prevalence of about 80% in the population, a deficiency in it. And it's really more about activating folate and then activating serotonin production and protecting you from other diseases. Its immunological role is a little less necessary, but I'll double check on that. Again, the key immunomodulators for us with your cell-mediated immunity and innate immunity are zinc and iodine, and just being on a multi and the vitamin D. Those are the key things. The fish oil is to prevent clot and stroke.
I always say this wrong. Quercetin. A, what are your thoughts on it? And B, there's somebody that always comments that when you talk about zinc, you forget to mention that she thinks it has to be taken with quercetin in order for it to be absorbed.
Okay, so quercetin, which is a natural product, is what we call a zinc ionophore. It helps get zinc into cells. Simple concept. Zinc gets into cells without quercetin. It's how it works. Okay, we absorb things. It's okay. Now, will quercetin facilitate it better? Yes, clearly. So that's always a positive. Now, what does Plaquenil do, or hydroxychloroquine? It's a massive zinc ionophore. So really that's what it does. It's well, there's three things, but anyway, that's one of the things it does. So if you take Q-certain with zinc, you're going to get better zinc levels in your cells to fight the virus. That's the theory. There's not direct proof, but I think it's completely plausible and highly likely. The thing about Q-certain, though, that I think is potentially even more interesting for COVID, and again, there's a limit on how many things we can do. So Q-certain, again, is a great add-on, but Q-certain's other role is part of the infectious process with COVID for people who escalate up is they get bradykinin levels that go up. And bradykinin is a peptide that really is kind of involved in more asthma and spasticity in the bronchioles and the respiratory airways and inflammation that's more like anaphylaxis or allergy or asthma driven. So Q-certain would have the potential, besides putting zinc into cells to fight the virus, zinc also decreases inflammatory responses, which I'll post a paper on, pretty technical paper, but pretty interesting. So it's more than just raising alpha interferon. The Q-certain can then modulate the anaphylaxis or asthma-like side effects of COVID, because that's the problem in the lungs, as it turns out. There's an asthma-like effect and an infectious-like effect, and then it mixes into this gobbledygook of horror. So that's why it's such a tough disease if you escalate like that. So Q-certain could have a role for people to take. I mean, I have no issues with it, but I think also, or I think it's a great idea. I mean it like that. It's just, I think I have to go with core. You can't have people doing 400 things. It's not realistic. So it's zinc, because zinc's going to absorb the vast majority of the time without any difficulty. It's vitamin D. It's a multivitamin. And it's melatonin, because the melatonin interrupts the inflammatory cascade in a slightly different way, but it has some similarities to the Q-certain. Then you want the omega-3. Then if you're going to do add-ons, because you're just like the most obsessive compulsive person ever, which is fabulous, but it gets tiresome for a lot of people because that's already a ton of stuff. You think about elderberry if you have any exposures to viruses. You think about Q-certain. You could think about turmeric again, because turmeric is super anti-inflammatory, super anti-cancer, and so you can make this whole list of supplements, but at a certain point, we have to be cost-effective and realistic.
Okay, and then one more. This has been asked a lot, but as different people are finding things out, is there a specific type or one type of zinc that is better or that you recommend?
We recommend zinc gluconate first and zinc piconate second. But at this point, with where the virus is, I don't care. Just get on some zinc, okay? And I get a lot of questions about, well, it's upsetting my stomach. Zinc upsets the stomach. So what do we do? So if you could start at 50 if you're a bigger person, start at 30 if you're a medium person, or 15 if you're a smaller person. 15, and it's a dose escalation in terms of severity. If you're taking 15 every day, after 2 or 3, 4 weeks, your alpha interferon is going to be in good shape, and your immune system's revving up. But if you're doing the 50, it's really going to get going. Plus, we like the pulse up to 150 to 200. But ultimately, if I can get you to take 10 milligrams of zinc a day as an adult, I'm thrilled, and that goes to Flintstones. One of the Flintstone kid vitamins, which 99.9% of us can tolerate, is a reasonable choice for people. It's cheap. There's 10 milligrams. Find the one with 10 milligrams of zinc in it. It's fine, and it will help you. And you can always think, I can tolerate one. Maybe I'll take a second one later. And so you can get to 20 that way. So you have to be creative.
Well, somebody had mentioned that they were still getting sick after taking it with their breakfast smoothie. Taking 50 milligrams with a breakfast smoothie.
I think you need solid food.
Yeah,
would work better.
Take it away from other medicine, because that's what was making, I think, me and the kids sick. Was taking it with medicines if you separate it. And
sometimes that can happen. Yeah. And if you're on Plaquenil already and you take the zinc, the Plaquenil can be a little hard on the stomach. And let's say, and I'm using Plaquenil, you're a rheumatoid arthritis patient or psoriatic arthritis or lupus or one of those disease processes. When you add zinc to the Plaquenil, it's not a toxicity, but they both can irritate the stomach. When I've taken Plaquenil when I've gotten exposed, without the zinc, because I'll do the pulse and then I'm staying on the Plaquenil. The Plaquenil gives me heartburn, so I have to really take it with food, and I start an over-the-counter like Tagamet to go with it, because it really can. The Plaquenil really gave me heartburn, and I've had some other people have that happen. Well, tons of people take Plaquenil and it's a nothing. I'm just a sensitive person. Well, that's it. Be safe. Keep in mind that remaining unbiased and friendly matters. Be pleasant when you're driving. Don't listen to your phone at full blast while you're eating food at a restaurant. Where Kim and I ate lunch today at am I allowed to say a name anymore? I'm done. Earl's Rib Palace, and they socially distance and everything's great, but socially distance doesn't mean having your phone listening to a video at full blast 3 tables away. I mean, I'm just amazed by people anymore. So anyway, good night. Take care.